So I wanted to talk a little bit about the recovery and preparing for your rhinoplasty procedure. What we usually do is we usually start out with a few consultations, but when you decide on doing your procedure and what date you decide to do your procedure, we usually have you come back 2 weeks before that date and we get you ready for your rhinoplasty. We're going to give you a bunch of material for you to read so that you can get really prepared to do this procedure, and that occurs 2 weeks before your procedure. What we usually tell you is that we want you not to eat or drink anything 6 hours before the procedure, but at that 6 hour point we want you to drink 64 ounces of Gatorade in order for us to have a better time starting your IV the next day. And we usually want you to bring your medications with you. The medications that we usually prescribe is an antibiotic and a anti-nausea medication, as well as a pain medication, and those are the usual 3 things that we prescribe, and we want you to bring that with you so that we can go over it with you, explain it to your caretaker. We want to have a caretaker to take care of you for mainly the 24 hours, but more than that's even better. But the first 24 hours is really important. At that 2 week point, we want you to stop all blood thinners 2 weeks before and 2 weeks after your rhinoplasty. We'll give you a whole list of things to avoid in terms of things that can thin your blood out, and we want you to stop those 2 weeks before, 2 weeks after, and be really vigilant about that. Now, there are some foods on this list, but we always say that you can eat some of those foods, just don't eat a large amount of those foods, because those can lead to increased oozing. And we're just being really careful when it comes to that. And then on the day of the procedure, we're going to go through everything again, so you can have more time to ask questions. We're going to go over the images again, and we're going to really solidify what we're planning on doing for your rhinoplasty procedure. And so you're going to have at least 3 points in our office and times at our office to ask questions and to really figure out what you want. And I take that time to really listen to you and try to figure out what's in your mind and what's important to you, and I bring that into the procedure when I'm doing the procedure, to really try to bring into the procedure all those thoughts and really trying to get what you want. In terms of the recovery, after the procedure, you're going to have a splint and some tape, and you're going to have a little mustache dressing. That mustache dressing is something there to catch any oozing, and we want you to change that as needed, and you want to tape that mustache dressing from here to here. That first night, I think if you can, we like to have you ice around the area like 20 minutes every hour, and sometimes it's hard to get that ice through the splint, so we want you to ice around your cheeks, up here, and around your mouth to try to get the coolness into the nose area. Now, the other thing you do to try to keep everything cool is to actually eat, consume popsicles afterwards and keep everything cool. You can even do smoothies and it can keep everything cool there. The other thing to try to cool your whole nasal areas, you can even start nasal irrigation in your nose, and you can use cool water to try to cool that area. That's one way. And what we usually tell you is after surgery, it's a good idea to try to start the Afrin nasal sprays, because that'll kind of constrict everything, keep the oozing down, kind of open up your airway, and also allow you to irrigate your nose better. Usually after you use the Afrin spray, I usually tell people to wait about a half an hour so it really opens up your nose and then irrigate. Now, there may be some crusting inside your nose, and what we want you to do is clean that out, usually with vinegar and water. Now, if it's really hard crusting, it's hard to get out with vinegar and water, what we suggest is using hydrogen peroxide, but very conservatively. The hydrogen peroxide can cause scarring, so you want to just use that hydrogen peroxide to get rid of most of the major crusting, but afterwards don't continue to use the hydrogen peroxide, because that can cause scarring in your nose and in your incision. So very conservatively you can use hydrogen peroxide, but we don't actually put it on your paperwork because we don't want you to overuse that. And if in doubt, don't use the hydrogen peroxide, but you can use the vinegar and water to clean inside your nose. Now, after you clean the incisions with vinegar and water, we also suggest using Vaseline inside as well as on your incision. And in terms of cleaning your incisions, we want your incisions to look as close as possible as a fine wrinkle. And you can, when you look at a wrinkle, it's really close together and there's no crusting in it. The crusting can actually lead to scarring, so you want all that crusting to be taken away. So with the vinegar and water, and very sparingly, maybe using hydrogen peroxide, clean that incision so it looks like a fine wrinkle, because that's the closer the skin edges heal together, the better this incision is going to be. In terms of caring for your incisions, we want you to clean your incisions 2 times a day, once in the morning, once at night. Now, if your incisions aren't like a fine wrinkle, then we want you to do this more frequently until you get to that point, and then start slowing down. But usually we tell you to clean your incisions twice a day. So what we usually tell people is to ice for about 10 to 20 minutes every hour. What you're going to do is you're going to take your antibiotics regularly, and usually it's every 6 hours. That's the only thing. The main thing that you need to take on a consistent basis is the antibiotics. The nausea medication and the pain medication is as needed. So we're going to go over all that with you. The nurse is going to go over that with you after the procedure with your caretaker. And I always try to call you that night, or have you call me that night to go over all your questions. And we also bring back the next day so you can go over all these instructions again. So what we usually tell people is we want you to sit when you're sleeping, kind of be more raised and kind of keep your head straight, because we don't want you to have more swelling on one side or the other when you lay on one side. Now that's most important in the first week or two. Of course, that's really hard to constantly sleep upright, so just do the best you can. Now, one thing is that when you take pain medication, there is possibilities that you can get constipated. So we don't suggest being on pain medication if you don't need to. If you get constipated, there are things that we suggest. For example, we want you to drink a lot of water so your urine's clear. That will help you with going to the bathroom. There's other things that you can take, and we can prescribe some of these things, but Colace, 100 milligrams twice a day for about a week or 2 can help. You can also use Metamucil, and there are enemas that you can do to help you go to the bathroom, because the pain medication can lead to constipation. But if any other further questions, you can call us and we can help you with that situation as well. Now, in terms of the bleeding, usually oozing from your nose is the greatest the first 24 hours. So there's 2 points that you can have oozing. The first is within the first 24 hours, and the next is 7 days, where you have some clots dissolve. So during that first week or 2, we want you to be really careful, because you can still have oozing. So you can do walks 2 to 3 times a day starting after 48 hours. But for the first 2 weeks, we don't want you to do any strenuous activity. Now, what we usually say is you get 60% of your healing at about 6 weeks. So also, you probably want to do about 60% of your effort in terms of exercise and exertion at 6 weeks, and about 90 to 100% at 6 months. So we usually say 2 weeks, start your exercise slowly, and then increase slowly after that, based on that 60% of your effort at 6 weeks and 90 to 100% at 6 months. So that's a really important point.